Hello, today's topic is necrosis under the chapter cell injury. So, we know that irreversible cell injury eventually after a certain point results in cell death. So, cell death is mainly of two types, necrosis and apoptosis. So, we will first see the differences between these two. So, let's start at the level of the nucleus. In apoptosis, what happens is that it is fragmented into nucleosome size fragments. But in necrosis, there can occur pycnosis, that is condensation of the nucleus, and karyorrhexis, that is fragmentation of the nucleus, and karyolysis, that is fading away. Then about the plasma membrane, while in apoptosis, the plasma membrane remains intact but undergoes alterations to attract phagocytes. But in case of necrosis, the plasma membrane is disrupted. And in necrosis, enzymatic digestion occurs and the contents may leak outside the cell. Whereas apoptosis, it remains intact. And also that the necrosis, the adjacent tissue, because of the necrosis, it invokes inflammatory reaction in the adjacent tissue. Whereas in apoptosis, this does not occur. And also necrosis is mostly always pathological in occurrence. Whereas apoptosis, it can be either physiological or can occur in pathological conditions as well. So these are the 5 types of necrosis that we will be seeing. One is coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis and fibrinoid necrosis. The first is coagulative necrosis. This is the most common type of necrosis that we encounter. So it is mainly due to denaturation of proteins. So the proteins which are denatured include structural proteins as well as enzymes. So along with the structural proteins, enzymes are also denatured. That is why proteolysis of cells is blocked, of the dead cells is blocked. And so the tissue architecture is preserved. And hence what you see is eosinophilic cells which are anucleate, that is without nucleus, and they persist. The heart is the most common organ in which coagulative necrosis is seen. And in fact, ischemia in all solid organs, almost all solid organs, is of the coagulative type. Exception here is brain, which shows liquefactive necrosis, which we'll be dealing with next. So this is a case of coagulative necrosis from the kidney. Here you can see the preserved outline. This is a gross specimen of coagulative necrosis in a kidney. So next is microscopic picture of coagulative necrosis in the kidney. So in this half, you can see that the normal kidney with glomerulus and tubules is maintained, whereas this side shows the areas of necrosis. Here you can see the outlines of the cells, eosinophilic cells is maintained and the nucleus is lost, and also you can see a lot of inflammation in between. So this is an example of microscopic picture of coagulative necrosis of the kidney. Another point I'd like to discuss here is why do necrotic cells show increased eosinophilia? See, in H&E stain, that is hematoxylin and eosin stain, this eosin stain is the one which is the acidic dye. So this eosin binds basic components. So what happens is that in necrosis, you know that there is decrease in the RNA, cytoplasmic as well as nuclear RNA, and there is increase in denatured proteins within the cytoplasm. And this increased denatured proteins go and bind to, show increased binding to the eosin dye. And that is the reason for increased eosinophilia in case of necrotic cells. Next is liquefactive necrosis. This type of necrosis most commonly occurs in bacterial infections. The reason is because microbial infections, they incite accumulation of leukocytes. So these leukocytes increasingly liberate enzymes. So these enzymes, what they do is they cause proteolysis and complete digestion of the cells. So as a result, the tissue architecture is totally lost. So unlike coagulative necrosis, in liquefactive necrosis, the tissue architecture is lost and the whole tissue is converted into a liquid viscous mass. So the classic example is that which occurs in brain. So as we already said, in other organs, other solid organs, it is usually coagulative necrosis, but in case of brain, mainly due to the lack of stromal support and the abundance of liquefactive enzymes, here liquefactive necrosis is most common. So this is the gross picture of a case of liquefactive necrosis. We can see dissolution of the whole brain tissue can be seen around the area of necrosis. The next is caseous necrosis. Caseous necrosis actually refers to a structureless form of necrosis, eosinophilic necrosis, most commonly seen in tuberculous infection. Other examples of caseous necrosis can also be seen in histoplasmosis or coccidiomycosis can also be seen, and the gross appearance is cheesy-like friable white appearance of caseous necrosis. This is a classic example of TB lung. Here you can see the cheesy white friable debris can be seen. This is the microscopic view. This which you see is the structureless eosinophilic area of caseous necrosis, and here adjacent to it you can see area of epithelioid histiocytes, and here you can see multinucleate giant cells. So this is a classic case of TB lung showing caseous necrosis. Next is fat necrosis. So fat necrosis actually refers to focal areas of fat destruction. So a classic example of this is acute pancreatitis. Acute pancreatitis is actually a medical emergency. So what happens is mainly lipase activation. Out of the pancreatic acinar cells, these enzymes leak out. Then they become activated and triglycerides are split into fatty acids. These fatty acids make a complex with calcium, and this is what is called as fat saponification. So it is grossly seen as chalky white areas. See, the chalky white areas classically seen in cases of fat necrosis. This is a microscopic picture of fat necrosis in the breast tissue. Here you can see the necrotic adipocytes, and these regions show collection of white foamy histiocytes. Finally, we have fibrinoid necrosis. This is a type of necrosis pattern which is seen in case of immune complex deposition composed of antigen-antibody complexes in the wall of arteries. So here, along with the immune complex, when there is fibrin which has leaked from the vessels, so these two together give the pink amorphous appearance that is seen in microscopy. See, this is a case of fibrinoid necrosis in an artery in a patient with polyarteritis nodosa. So finally, a couple of questions. Coagulative necrosis is seen in all except. So we said that coagulative necrosis is commonly seen in all solid organs. Exception is brain, where we see liquefactive necrosis. Next is fat necrosis is common in, one is omentum. Yes, it is common in omentum. In breast also it is common, and in retroperitoneal fat also we commonly see fat necrosis. So the answer is all of the above.